So we'll go ahead and record that now. And we'll just give everybody a few minutes to get settled in before we begin. Okay, hi, I'm Jessica Pyatt-Walczyk. I'm here on behalf of the Greater Watertown North Country Chamber of Commerce. I'm the Director of Marketing here, while here being my home because many of us are working remotely these days. And I just wanted to tell you a little bit about Coffee Talk and this new series that we are doing at the Chamber of Commerce. Essentially, we are putting together this series to give people the opportunity to talk to one another, to stay connected while practicing safe social distancing. This will allow us to get together twice a week on Tuesday mornings. It's a casual conversation, a digital dialogue where we can all get together, talk about the impacts this has on our community, on our business, how we're reacting. And then on Thursdays, the Chamber is actually following up with special guests that are experts on different topics that have been deemed of interest. So we are very glad to have Steve Jennings with us this morning. He is a planner at Jefferson County Public Health Service. Thank you so much for being here with us.
My pleasure, glad to be.
So if you haven't been on Zoom before, I'm just gonna let everyone know we're doing our video and audio just to see a familiar face during this process. If you want to see us both as we speak, there is a feature where you can set it up to be spotlight. So we'll change as the voices are being used. And then if you have any additional questions, you weren't able to submit one ahead of time, there's a chat feature as well. So please use that to engage with us throughout our coffee talk this morning. All right, so Steve, if you don't mind just starting off with a brief overview of COVID-19 and the current status that our county is in.
Sure, so people might want to know what COVID-19 actually is, and it is a new coronavirus that originated in China and in the year of 2019 and has been particularly virulent and is very, now we really understand, very contagious to the point that we're now in a worldwide pandemic. So COVID-19, it's a new respiratory illness basically, and the symptoms for it are fever, cough, and shortness of breath. It can turn into double pneumonia, and it really targets people who are immunocompromised and the elderly. And so you're seeing around the world, and we can talk about this, people may have questions about why we're doing social isolation as government policy. You can see what's happening around the world in the countries that didn't respond to it as quickly as perhaps they could have or should have, and who didn't have the health system to take care of, help take care of the problem. The virus spreads, again, very quickly. It's mainly from person to person. It started, it's believed, by somehow transmitting from an animal, which is typical in coronaviruses. There are many, many types of coronaviruses in the animal kingdom and in the human kingdom. And many times they transfer over from animals. And coronaviruses are actually very common. When you have a common cold, it's very likely some type of coronavirus. Why is it such a concern? We think it transmits when people are symptomatic, and that would be when they're most sick. But there's thought that it could transmit before people actually have the symptoms. And again, it's droplet spread. You would cough or sneeze, and you would have to be within 6 feet proximity of someone to infect them, or the droplets could land on a surface and people would touch them and they would get disease that way. Another thought about this particular coronavirus, COVID-19, is that the droplet lives longer than a typical coronavirus. We don't know how long. It could be a few hours. It could be longer than a day. And it would have to, the environment for that to happen, I'm sure, is a factor as well. All that is trying to be understood at the moment. believe it's true because the spread is because it's so widespread and it's so contagious and so infectious. So that's kind of an overview of COVID-19. And then Jessica, if I could just give folks a status report on what we're seeing in Jefferson County to date. The numbers are as of yesterday. There will be new numbers today and they'll be issued early this afternoon. But as of yesterday, a total of 303 people in our community were tested for COVID-19. We've received 2 positive tests, and they are unrelated to each other. People may want to know that. We've received 106 negative tests, and we have another 195 pending. When people are tested, they are the provider is supposed to contact us so that we can put them into precautionary quarantine. We don't want them out and about while we're waiting for that test result, because if it comes back positive, obviously they're positive all through that period, and we don't want them to infect anybody else. So everybody who's tested should be in precautionary quarantine. And yesterday we had 168 individuals there. We had another 8 in mandatory quarantine. Those folks would have had a travel history to one of the most highest impacted countries, which are China, Iran, Japan, South Korea, and Italy. Spain may be added to that list shortly. They're having a horrible time there. So we have 8 in mandatory quarantine. Some have had travel history. Some were associated with the 2 positive cases. And then the 2 positive cases are in what we call mandatory isolation. And so all of these folks in the different quarantines and in the isolation are monitored by our health department daily. And to make sure people we're monitoring their symptoms, obviously, we're monitoring illness. And particularly the folks in mandatory isolation, the 2 who tested positive, we want to make sure that they have everything they need so that they can stay home and try to get healthy. None of our 2 individuals have been hospitalized, which is good, but still ill. So we want to make sure that they can, again, stay home and get better there. I think that's it.
Would you mind just elaborating on those definitions between the different terms of isolations and quarantines that you introduced during your overview and status update?
Sure, I can give folks the definitions. So mandatory isolation, if you are tested and the test comes back positive, you are in mandatory isolation. And so only the local health department can put people into these isolations and quarantines. Mandatory isolation simply means you tested positive, and it's whether you display some symptoms or not, you could be put into mandatory isolation if you test positive. Our 2 individuals obviously had symptoms. That's that. Mandatory quarantine, if you've been within close contact of someone who tested positive, and that our marker for that is within 6 feet, you would go into mandatory quarantine, even if you're not displaying symptoms, so we can protect you. Also, if you have travel history to those countries I mentioned previously, those are called level 3 countries, the highest risk. You would be put into mandatory quarantine. In the beginning of this, we had a lot more people coming back from traveling. That's kind of come down because I think people are home now or they're staying where they're at. But you never know. You can still have people coming in potentially. And then precautionary quarantine, it means a number of things. Could be travel history with no symptoms. You would be put into precautionary quarantine. If you've had proximate exposure to a person, but not direct contact with a person, and we would learn that through who was positive, and we would learn that through our case investigation of those positive people. Or if you've been tested and are waiting for the result, automatic, you're in precautionary quarantine till we get that result back. And the results take about 4 to 5 days. New York State has opened up labs to process tests, and they're approved to do it, but they're not all online yet. And most all of our test specimens have gone to LabCorp, which is a national lab. Wadsworth Lab, the state lab, now is only taking tests from people who are truly ill, and they can process them very, very quickly. Well, they're all ill, but people in the hospital, people who would be in a nursing home, Wadsworth would run those tests.
I appreciate that. And I just want to give a follow-up real quick for everybody who was joining us during that. Again, I'm Jessica Pyatt-Walczyk, and this is our special guest speaker, Steve Jennings. He is a planner at the Jefferson County Public Health Service. He just gave us an overview of COVID-19 and a status update for where we are at this point. We'll dive into our questions. We did receive some ahead of time. If you have a question that you didn't have a chance to submit ahead of time, or that you don't think of until this coffee talk is going on, please submit that through the chat. That way we can address those at the end of the questions that we have prepared ahead of time. All right, so as you had said in your status update, there are 2 positive cases in Jefferson County. Why are we implementing such strict business regulations at this time?
So it's really social regulations, right? Because this has spread around the world very, very quickly in a matter of months. And we have the benefit of seeing countries who didn't handle it well and countries who did. And the countries that handled it well adopted countrywide, statewide policy around social isolation, keep people at home, slow everything down, have people stay at home, reduce the chance of disease transmission. And those strategies in the countries that did those things seem to have worked best. We have to do it because, as painful as it is, we don't want to wind up like Iran and Italy and China, where there are massive numbers of deaths. Spain is coming, I mentioned that earlier, more and more deaths every day in Spain. The healthcare system can't handle it, and people are just getting sick and dying. People have probably heard about flattening the curve. We want to preserve the healthcare resources we have and not hopefully have to exceed those amounts. And we do that by the social isolation policies. New York State is interesting because you have New York City, where half the state's population is located. So it's very dense from a population standpoint. And then the rest of the state, which is not that dense, particularly upstate New York. Our governor has chosen to do a statewide policy, but you can see New York is the epicenter. New York City is the epicenter, and it's because the population is so dense, and people are just transmitting disease much easier down there. So we have 2 positive cases here. We probably will have more. We're trying to keep that down, and we're testing people who their providers feel they must meet criteria for testing. It's a confusing time for testing because the symptoms are very similar to normal cold and flu season, which we're right in the middle of. So I think that's why we have so much testing happening, and why we have so many negative results at the moment.
So one of the questions we actually received was, what are the qualifications for a test, such as does a person need to show a sign of sickness? It sounds as though that's been one of the points of concern in terms of transmission, but if you could elaborate on what the qualification for a test is at this point, I think our audience would greatly appreciate that.
So they're still looking, so it's up to the provider. Okay. In the beginning of this, because there was such a lack of test kits, People to be tested had to be approved by our department. That is no longer the case. The provider can make that determination. But they're supposed to notify us when they test someone so we can put that individual into precautionary quarantine. I will say most providers are doing it. Not all of them are doing it. We're actually looking at, we know that now because we're getting the negative results. And we know the providers never called us on some of these folks. And so we actually started yesterday going down the list and looking at, is it providers across the community or is it a few? And we're going to be reaching out and trying to understand that and letting them know they need to let us know that because we want to reduce disease spread. But in terms of your question, let's see. What was the question again, Jessica?
The qualifications for a test.
Right. So they're going to be looking at fever, a cough, difficulty breathing. Difficulty breathing is key, shortness of breath. And they're still looking at travel history. Did you travel yourself or were you exposed to anybody who might have traveled to one of the level 3 high-risk countries? That's still a fact. It's getting more and more likely to be a person-to-person spread. We're also looking at travel within this country and within this state. Did you go down to New York City? Did you go down to Westchester County within the last 14 days? Those types of things. Because those are epicenters and people could have been exposed there.
Thank you for clarifying those qualifications. I know we all appreciate it. So one of the other questions that we received is on the business line, and what the concern for many of our members might be is when businesses might be able to open back up, or more specifically, what needs to happen in order for those executive orders to be lifted. Obviously, as you stated, Jefferson County is not in the same place that New York City is in, but if you could shed some light on what needs to take place before that would be considered.
Well, first let me say, as a public health department, we're very concerned about the economy. People unemployed, not working is not good for public health either. But obviously, we believe that the measures implemented will work to suppress this disease. So it's a balancing act. We don't know when businesses will open up. I know we're getting a lot of calls from businesses. That's kind of not our lane, if you will. But people have a lot of questions, particularly as relates to the Department of Health regulations. We're trying to answer any questions they have regarding Department of Health matters, but then bridge them to the economic development folks in our community, the employment folks in our community, and try to make sure that they're taken care of. And I think you saw yesterday with the approval in the Senate of the stimulus legislation, there's a lot of effort and there's going to be a lot of money coming down to make sure businesses can bridge to when we can get out of this and hope and keep people employed, hopefully. So I don't have an answer as to when it will end, but if people practice the social isolation and we do everything we can to suppress this disease, we should theoretically get out of this sooner. And the other thing that could happen potentially, and I have no inside knowledge, but because upstate is not as densely populated as New York City, maybe there'll be a divergent approach to upstate, and maybe we could get back to normal sooner. I don't know the answer to that.
Well, thank you for your candor. I do appreciate that. And while we do have a few more questions that were submitted ahead of time, there are a few that are going on in the chat. I know in your status update, you did mention that there are the 2 confirmed cases and that they were not related cases. One of our participants is curious to know if there are any measures being taken to find the individuals that might have, for lack of a better way of saying it, transferred that disease to those who tested positive?
Well, so what we do with every positive case is do a line list contact listing. Who were they around within a period of time before, from the date they were symptomatic, is what the State Department of Health makes us do. And those lists are extensive. I mean, depending on where the person was, if they were working the day they developed symptoms, or where were they, who did they possibly expose, did they travel. We look at if they were on a flight, or if they were on a bus, or if they were on a train. I mean, we're literally notifying those entities and trying to find out who the passengers were. We wouldn't follow them because most of them wouldn't be here in Jefferson County, but the counties where they are in New York State would be reaching out to those folks. And we're monitoring those folks as well to see in our county if they develop symptoms because of potential exposure. So I think the question was, do we try to find how they contracted disease? We don't have ability to do that usually. We start looking at the date they're symptomatic.
Okay, and yes, so the question was, at least, assuming that two other individuals had transmitted the disease to them, how are we finding those individuals? So that sheds some light on the process in terms of what the communication looks like from our county to where others might have traveled from. Jonathan, I hope that you feel that was a good answer to your question as well. I know that you did explain the process to those of us who are listening who are very unfamiliar with what it looks like from your office. And I know I had the pleasure of chatting with you a little bit before this started in terms of what that communication looks like from when you receive information from the Department of Health. If you could just give a quick glimpse into that, just so that for everyone's understanding, we have a better idea of how that operates.
So when we do a line list contact of folks, we may not call them again, depending on their exposure or what they tell us, or we may put them into some type of quarantine. We're doing all of those things. We also, which might be of interest to some of your folks, we're getting more and more requests for letters to justify to their employers why they need to be out. We just can't do that for everybody. You need to have been tested and into quarantine. So and then you would have daily contact from our department.
Okay, thank you. I appreciate that. So a few of the other questions that we received ahead of time also include, and I know that you had mentioned you're not sure the exact duration of how long the disease can be transmitted from droplets, but one of the questions we received is, with knowing that it can last on surfaces, is there a suggested proper way to handle packages that are received? Should there be a concern surrounding receiving a package and properly sanitizing it before handling it?
Our advice has been to constantly wash your hands. You can handle a package and remove the contacts. You can be very careful about handling a package and should be in your mail, but constantly wash your hands. And don't, make sure packaging is thrown out and away from people. We would advise that. But again, constantly wash your hands, constantly clean surfaces. And we have guidance documents available through our website you can access at jcphs.org. And then the chamber has, and I don't know if you built the page, Jessica, but you have great information there. It's the same information we have about how to clean and other guidance.
Thank you. I do appreciate that. It's been so wonderful to have community connections at this time. The Chamber of Commerce always feels that it's important to have those partnerships. So the page that Steve's referring to is our COVID-19 update, where we do list some of the Department of Health resources. additional resources and a few financial resources that are available, as well as just a letter update from Kylie, our president and CEO, as we're going to continue to update that each week. So that being said, you can use both our resource and also Jefferson County's as well. One of the other questions that we have received, and I know you mentioned some of the symptoms that might alert some extra awareness during this time, such as fever, cough. I haven't heard this one myself, but someone mentioned a concern about a rumor for loss of sense of smell and taste being an early indicator, perhaps.
So we're hearing that as well. So I guess when we say symptoms, the ones I described before, those are the common symptoms. We're hearing the other ones you described. We're also hearing early onset of diarrhea. Those are unknowns, and I think you have to just present all that to your provider when you're formulating a request to get tested for COVID-19. And I think they would look at all of those factors together to determine whether someone needed a test. Again, we're in line with flu and cold season and other kinds of illnesses going around this time of year. But all those factors, if someone's experiencing that, should be presented to your provider.
All right, and we received another question in the chat, so I'm going to move from our list of pre-questions over to this. Mike Lumbus submitted one, and he wrote, I read this morning in the Watertown Times that many people are leaving New York City area and are returning to their summer homes along the lake and river. In addition, many snowbirds are returning to the area as well. Are there any quarantine implications for those that are coming into the area? Should they self-quarantine after returning?
So we are talking about that. We already know what's happening. And we're kind of flummoxed by it because we don't really know what to do. There isn't any policy. People aren't restricted to come here. And so I read the same article, and I saw a couple of counties, I believe, over to the east are writing letters or maybe even pass legislation, I can't quite remember, about that people can come in, but they must self-quarantine for 14 days or they're asked not to come. And then there was another county, I believe, in the article that's for a village or a town, I think it was Saranac Lake. Don't quote me though, that said we can't stop people from coming in. They own property, they have a right to be there. We're concerned about it here because if people come in sick, we're going to have to obviously take care of them. And that's a tax to our healthcare system. And if they're sick and positive, they could be spreading it to people who live here. We're very concerned about that and aware of it. All I can say is we're discussing it as well, and don't quite have an answer as to what to do about it, and don't know what we can legally do about it. But certainly, if people come in, yes, we want them to, especially if they're sick, to self-isolate, self-quarantine.
Well, thank you very much for that answer. And gentlemen, thank you for asking those questions in the chat and using this feature in Zoom. I do appreciate your interest and putting those questions out there so that we can all have an answer and gain clarity in this current situation. I will like to move back to the questions that we got ahead of time. There's just a few more of those, but if you do have other questions, please feel free to put them in the chat. Our guest has been very flexible with us, and he is working with us to answer those questions. So Stephen, thank you so much for that. I do appreciate it.
Sure, my pleasure.
I know we all do. So one of the other questions that we have here for you is, will there be resources available for businesses at the county level that might mitigate the economic impact of COVID-19? Have you heard anything from any of the other, maybe some of the county elected officials that you've been working with, or any rumors that that's something that is being worked on for businesses in Jefferson County?
So I haven't heard anything, but I know this morning, and I think other folks on this call may be aware as well, the Jefferson County Industrial Development Authority is having a quite large meeting with folks to discuss all these issues and factors. And we obviously get calls about it, and we're referring folks out to the economic development sources and to the employment and training office that the county runs. I'm not aware if what the county will be doing. I think we're in uncharted territory. This is my opinion, and there's probably other experts who can answer these questions better. But I think we're learning as we go. And I think, as I said earlier, the federal stimulus that's coming is going to play a role. But I don't think people have an understanding exactly of how that's going to work. I don't even think our Congress people and senators have an understanding quite yet about it's such a fast moving train. But I believe help is on the way. And we're interested, obviously, from a public health standpoint, of making sure our economy is supported. Because if we have a bad economy, it's not good for public health. And we recognize that and want to be supportive of efforts. What's the balance to keep things going and protect the public's health? Those are things we're interested in.
So many of us that are concerned about the economic impact obviously see it from a commerce perspective, and you've mentioned twice now that from a public health perspective, you also see it as a concern. Could you just delineate a little bit on what you mean by that?
So in normal times, and we're always concerned about the economy, because if you look at public health and social determinants of health, people who live in vibrant economies are healthier. And so, if they have access to good employment, if they can meet their basic needs, if they have good education, all of those things feed into better public health, better nutrition, lower crime. So we're always working on those things, like I said, in normal times. And so with this particular issue, it's so overwhelming. We're hopeful that things can be done to bridge businesses back to normalcy, whatever that will be, where people are employed and most people are not unemployed. And so again, we know the science behind it, want to make sure that happens, want to contribute to that any way we can, those types of things.
Thank you. So our final question from the pre-submitted questions, and again, if you have additional questions, please put them in the chat. I will be looking at that after this final question we have, and that is, in your professional opinion, what has been the biggest source of misinformation surrounding COVID-19?
Probably that the isolation measures put in place are an overreaction. I think they will prove to have mitigated disease if we all do it, what we're supposed to do, that they will not overtax our healthcare system, because our healthcare system was fragile before this started, frankly. And that if we do all those things, this could be over quicker.
All right. So that biggest source of miscommunication or misunderstanding would be that the self-quarantining is an overreaction. That would be your personal or professional opinion on the matter.
Yes, because if you look at the countries that were very, very late to respond, it was too late, and it's an absolute disaster. I mean, it really is. It's very sad.
Do you have any advice for how we can communicate to our coworkers, to our peers, to our friends and family on the severity of what self-isolation can do for the benefit of our community?
Well, obviously it mitigates disease and suppresses it. We want to make sure, and it's very hard for people, but if you have elder relatives or people who are immune compromised, just to keep away from them. One of the luxuries we have today is the technology, so you can still, we're in contact today as if we're in the same room, but we're very far apart, you know what I'm saying? So those types of things. I think it's very hard for people who have loved ones in nursing homes because you can't go in. but really it is the exact correct thing to do. And we saw in our country where this really all unraveled was in Washington State in a nursing home. Those folks are very fragile, and we need to protect them. And so I think in New York State, we've done a lot to get out in front of it and protect people. But another major factor, people were upset when it happened, was closing the schools, because children don't get COVID. They get COVID-19, but they don't have a severe case typically, but they can spread it. And schools are just breeding grounds for spreading disease all the time because they're in close contact. And the little ones especially don't have good respiratory etiquette. And so droplet spread of disease can really run rampant there, and does, as does flu. So that initiative really, that's evidential to work. And I don't know what will happen with schools, if they will stay closed the rest of the year or open sooner. I think it'll depend on how we monitor and measure whether our suppression efforts are working, and hopefully it'll be sooner than later.
Thank you. So I do see in the chat we did have another question. It looks like it was tagged on to Mike Loomis's question, but Steve Bradley asked, in addition to whether or not the snowbirds and the families that come up for the summer should be self-quarantining, whether or not, and you might have touched on this in your previous answer, but whether or not a roadblock might be considered for the main arteries while keeping it positive, but to require self-quarantine. If you would just touch on that again, I know we would appreciate it.
I don't know at the policy level if that would be considered. They did do something like that in New Rochelle that I think was administered by the state. So I guess it's not out of the question. But as of the moment, from what I understand, there's no talk of that or plan for that. And again, we're trying to figure out how do we've heard from folks about this issue, obviously, and how do we address it? And so the other thing is, if people are coming in here sick and we never know about it, what are we going to do? We might find out about it if they transmit disease, or they might be here sick and recovering and truly isolating themselves. So we're very cognizant of the issue, and we know where people like to come up here on vacation. Obviously, we have a significant coastline, and we're hearing anecdotally from people that people are coming in. So I guess all I can say is we're going to keep discussing it.
All right, thank you very much. And I don't see any additional questions here. Oh, actually, one other just popped up. I'm going to read this. It's from Jonathan Hamilton. This might not be a valid question for you, but what are some resources that I can share with friends and family that have been laid off during the outbreak? So many people I know are out of the job, yet they are still paying a lot of their bills and are getting closer to not having additional resources such as money or food. And in addition, for the elderly that are running out of resources too, what can we do to help them without getting into contact with them? Thank you for that question, Jonathan.
Yeah, so again, on the business front and the employment front, I think just stay tuned for more things coming. We're not aware of what's coming down from the folks in the government who handle those issues, but we know they're working hard on it. And, from a public health standpoint, again, we are encouraging a way to quickly figure out how to bridge folks. In terms of accessing resources and food in real time, I know in Watertown, Urban Mission is ramping up food distribution. We want to protect our elderly, so if anybody can help them, they should. And if they need things, get things to them. People can go out and do their shopping, or even go to Urban Mission and pick up supplies and put it on their doorstep. Those types of things to keep distance. And you're seeing that happen actually all over the community, in my opinion. So.
Jonathan, I would just like to add, the Chamber of Commerce does have a page that we're currently updating. We have several partnerships within the community, including Steve Jennings, and we're so thankful for that. And we're trying to keep up with some of the resources that we find. So we're going to continue to update that page. And here with Coffee Talk, not only are we providing a platform where people can communicate and ask these questions, but when we see themes of interest, we're going to be bringing on other experts as well throughout the duration of this experience. So if you do have questions to follow up, please, I'm going to put my email in the chat. And if you have some contact information for your office, Stephen, I would invite you to do that as well, or whatever might be the appropriate method. That way, if you do have additional questions after this coffee talk, our office can work to bring those to you. And I'm certain that Jefferson County Public Health Service can do that as well. So I will do that now before I forget.
And so it's, again, Jessica, we're fielding lots of different calls. Some of them really aren't public or health related in terms of the questions. We are working to make sure we get people to where they need to be. And any call I get, I'm trying to make sure people get the answers they need and the help they need.
Definitely. And if anybody, I know Steve Bradley just put a possible resource in the chat. If you have resources, if you know businesses like the Urban Mission that are ramping up what they do at their food pantry, let us know. So that way when our office gets calls, when Jefferson County Public Health Service gets calls, we'll be better equipped to disperse that information. That being said, I am so grateful for your time. I know so many of us who have joined this coffee chat are thankful for your expertise on this matter. If you have anything additional that you would like to add or share with us, I invite you to do so.
I would just ask for people's patience to work with us, to truly follow the isolation protocols. It will help. It'll help end this quicker. I truly believe it. And we're very hopeful for that. And if people need help, there are resources available. They can call our office, or they can call, employment or economic development. There's many people at an agency level and at all levels of government working very hard to try to help people get through this. And we're here. That's why we're here, and we'll get through it together.
Wonderful. And before I give everyone an update on what we have coming up next with Coffee Talk, I know before the chat began, you and I talked about Facebook Live and how your office has been using that as a platform. Do you want to tell people when the next one is that they can join in on?
I believe the next one is, I should know that, I think it's tomorrow. So people can call or join our Facebook Live. Our lead health promotion and health education staff are facilitating those, and they can ask any public health questions they want and get answers. And it's nice because it's a group chat, so you can, other people will ask questions, and that might spark you to ask a related or another type of question. And if they don't know the answer, they'll get it for you. And so they've been on regularly. We have found that people really want to talk to somebody during this outbreak. So we've been very skilled at social media, where you just put out, Facebook and Instagram things. And that's still beneficial for people. But people, we find during the COVID-19 issue, they really want to talk to somebody. So that's a way. We get so many phone calls, and we're returning them all, but it takes a while. That's a way to get an instant answer on some issues from some experts in our office. So I believe it's tomorrow, Facebook Live.
That sounds familiar to me. I think it's tomorrow at 11 a.m. We did share their schedule on our Facebook page, and they have their schedule up on there. So please check that out. And join us next week. The Chamber of Commerce, again, is doing a brand new web series. It is called Coffee Talk. On Tuesdays, it's a digital dialogue set up for casual conversation where we can get together because we believe in practicing safe social distancing, but that doesn't mean that we can't take advantage of the technologies we have today in 2020, and we are very thankful for that as a resource. So I'll put that link up on our social media as well as on our email list. If you are on that, please check that out or join it if you would like to keep informed. It's going to be Tuesday at 9:30. It's your opportunity to express some of your concerns or some of your ideas so that we can better set up these expert guest speakers such as Steve Jennings. We're so thankful for your time. Thank you so much for joining us today. Everybody in the audience, thank you for your questions. Thank you for your attention and for being with us here digitally this morning. We did record this session, so if you have any follow-up questions or want to get a copy of that, please reach out. I did put my email in the chat, but we are really thankful that you could all be with us here this morning. We hope you all are doing well and staying safe. All right. I am going to stop my audio and my video, but I'll leave the conference up for a few minutes longer, probably until about 10:20. So if you want to look into the chat and see if there's anything you missed or grab those contacts, that you can do so freely and willingly. Thank you all very much and have a great rest of your day.
Are we done?